Sustainable health and well-being of Nigerians, promoting health choices for healthy lifestyles. World Health Organization works to ensure healthy lives and promote well-being for all ages, leaving no one behind, with a target of ensuring 1 billion more people enjoying better life and health well-being globally.
We conducted a qualitative insight gathering research, and we identified certain barriers that were preventing women from accessing family planning services within the communities. One of those barriers or social norms that we identified is that in communities, men with large families were regarded as wealthy or were regarded as the big men of the communities. And it had nothing to do with how well their families were being taken care of or how healthy their families were, but just how big the families were. So this is one of the social norms that we identified, and so in 2021 we decided to conduct a pilot program in Bauchi, in Jigawa, and in Kano, where we trained 20 tea vendors in each of these states, and we trained them on initiating conversations about family planning services within their community. We also trained them on relationship building skills, so communication, negotiation, conflict resolution, so that amongst their own family unit, that family unit is stronger, but they're also able to pass on that information to their customers as they engage with community members. And then we also gave them a small business empowerment as an incentive to participate within the pilot.
Health promotion ensures people to increase control over their own health. It covers a wide range of social and environmental interventions that are designed to benefit and protect individuals' health and quality of life by addressing and preventing the root causes of ill health, not just focusing on treatment and cure.
As well as all the 36 commissioners and the FCT, because we made a decision in November 2023 at the last National Council on Health that we need to pick a day that we celebrate health promotion when we met in Ekiti. We are now implementing that resolution by celebrating a day dedicated to health. So I thank all the 36 state governments, their honorable commissioners, their officials, and the FCT, as well as our partners. There are various associations, civil society, private sector, development partners who are part of this effort because it's important to do so. The backdrop to this is, as you know, we have a president who is visionary enough to see that Nigeria's people are its assets and that in the future of this country there's a possibility of prosperity. And that prosperity comes if you have a healthy, well-developed population. And that's why health and well-being of Nigerians has been one of the key pillars of the President's Uniform Agenda. And when we set our goals last year, and when the President unveiled his agenda, we said our goal is to save lives, to reduce physical and financial pain, to produce health for all Nigerians. Because we realize that there are certain diseases that are evolving to be a key part of our burden of disease, non-communicable diseases, hypertension, diabetes, cancers, that are creeping up, but a large part of those diseases are actually preventable. And things like mental health. There are also others that are vaccine preventable. This morning, we met with countries of Burkina Faso, Mali, Niger, Sierra Leone, Cote d'Ivoire, and us here in Nigeria as part of the REACH network, trying to prevent child mortality by administering azithromycin as part of the REACH network. So this is translating the vision of the President into concreteness to affect the lives of Nigerians. And so health promotion is really about producing health. It's about producing stock of health. Because if you look at the 220 million Nigerians who are estimated to be those in this land, only a fraction are sick, are in the hospitals. More than 200 of them are either sick, they don't know that they are sick, or they are well, and we want to keep them well. So this day is to celebrate health promotion, to produce stock of health for all Nigerians. Because even if you are healthy today, there are steps that you can take to promote your health, to preserve your health. Because by the time you get sick, it's probably too late, it's costly for you, it's costly for your family, it's costly for the government to treat you. And for us in the Federal Ministry of Health, we want to be the Ministry of Health, not the Ministry of Sickness or Ministry of Disease. And because of that, health promotion is such an important element of what we do. I'm picking this day to educate Nigerians, to be aware that there are things that we can do. Whether it's making sure women go to antenatal care, go to have skilled birth to prevent maternal mortality, and get their children immunized to prevent diseases like measles, or for all of us to check our blood pressure that are adults, check your glucose, check your cholesterol, know your numbers, so that we can prevent complications from those diseases that are silent killers like hypertension. Because many people will carry along not knowing that they have hypertension or they have diabetes until when they start having complications. That's why I'm very pleased that the 36 Commissioners of Health of Nigeria and the FCT are joining us to launch the Know Your Numbers campaign. And that is ongoing across all the states of the Federation. For all adults to check your blood pressure, check your glucose, check your cholesterol, track it. If you have an issue, go to a provider. Because even if you have hypertension, you can treat it before it gets complicated. If you have diabetes, you can treat it before it gets complicated. And to take actions, avoid processed foods, exercise as much as you can, live safe life, protect really your environment so that you prevent yourself from getting diseases, so that the Nigerians that are healthy today will only increase in number and less of us will be sick, in which case the hospitals will become less and less where we should be going. Basic hygiene is also a preventive thing. And mental health.
World Health Organizations remains committed to supporting Federal Ministry of Health and Social Welfare and state ministries of health to implement health promotions, interventions to empower people and communities to make their own healthy choices for healthy lifestyles.
Things like Vulnerable Group Fund, which has never been, it's in the National Health Act, but it has never been appropriated for until this year for the first time. It's been appropriated for, and that is going to increase our national health insurance coverage, which is very much needed. And health promotion is a key area in this. Well, I am particularly, I'm very happy that you are emphasizing on data, and how the volume of data is a very great resource that we need in this country. We need to build that volume of data. The other day, I was invited to be in the maiden launching of the SEED project. I don't know whether you've heard of it. The SEED project. It's a way of putting together information and data from the primary health centers, to enable the ministry and its partners understand what is going on as far as, like you said, infant mortality, maternal mortality, child death rate. Where are we exactly? How many numbers are coming in every day? How many numbers are coming in every week? Not just to assume or estimate, but actual counting into this high-tech thing, this technology, which is very, very good.
In the past 7 years, and in collaboration with other USAID IPs, the USAID projects have supported, have worked to improve the practice of health promotion across the country. Over the years, the projects collaborated with the Health Promotion Division of departments of the Federal Ministry of Health, the National Primary Health Care Development Agency, Nigerian Center for Disease Control and Prevention, and other MDAs to implement multiple health promotion activities and to develop and disseminate national policies across the country.
When it comes to preventive approaches to health, in fact, for me, there are 3 P's I say. Number 1 is promotion of health. protection of health, and number 3 is preventive measures in health. And this health promotion encapsulates all of these things that I just mentioned. And then in the vision of the new coordinating minister for they agreed in the last National Council of Health in Ekiti State that come this year, Nigeria should launch the first health promotion day commemoration. And this is the first in Africa. I don't know about it, but in Africa this is the first country that is launching it. And this is to create awareness. And there is a tag to it, know your numbers. 10 million people know your numbers. And those numbers means know your blood pressure.
Budget lines that are required for executing these transformations available, created, and oversight. So we are very passionate about that because we know that health promotion we want the people to understand that how they can be self-aware and how they can take up health styles that are healthy, that promote life, promote longevity, and will prevent morbidity from preventable from waxing disease. For instance, when I was young, and make sure that to the point where in 2040 we are part of the country that